You took a pill this morning, maybe with your breakfast, maybe with a sip of water before the coffee finished brewing, maybe so automatically that you barely registered doing it at all. 10 seconds, that was it. And if you are over 60 and that pill was amlodipine, losartan, or lisinopril, there is a very real chance that something important may be happening inside your body that nobody fully explained when that prescription was first handed to you. Not because your doctor did anything wrong, not because anyone was trying to hide something from you, but because most blood pressure appointments move fast, and these medications may be simple to take. Yet what they do inside an older body is not always simple to understand. Her name was Margaret. She was 73 years old, a retired office manager, careful with every detail of her life, the kind of woman who used a weekly pill organizer and never missed a morning dose. She had been taking amlodipine for her blood pressure exactly as prescribed. No skip days, no guesswork, no carelessness. Then one afternoon, she noticed her shoes felt tight. By the next week, her ankles looked fuller. By the end of the month, she had stopped wearing one pair of shoes completely. She never said anything. Not to her daughter, not to her church friends, not even to her doctor at first, because in her mind, there were only two explanations. Either this was just part of getting older, or something was seriously wrong with her heart. So she did what many seniors do when they are frightened and not fully informed. She quietly started changing the medication on her own. Half a dose some days, skipped doses on days she needed to be out. A little less here, none there, just enough to feel like she was in control. What she did not realize was that the swelling was a known effect of the medicine, but the rising blood pressure from skipping doses was the more dangerous problem. That is the part no one had properly connected for her. My name is Dr. Clara Hoffman, and what I want to share with you today are the 9 most important things every senior needs to know if they are taking amlodipine, losartan, or lisinopril for blood pressure. Not because these are bad medications. In many cases, they are helpful, effective, and absolutely appropriate, but because the best results do not come from swallowing a pill blindly. They come from understanding what that pill is doing, what it is not doing, what symptoms matter, and which changes you should never ignore. Before we go any further, I want to ask you something. How old are you, and which of these 3 medications are you taking right now? Amlodipine, losartan, or lisinopril? And while you think about that, ask yourself this question honestly. Since starting your blood pressure medication, have you noticed anything that you quietly brushed off as just getting older? A cough, swollen ankles, dizziness when standing, weakness, a strange heartbeat. If you have, you are not the only one. And if clear, practical guidance is what you have been looking for, stay with me all the way to the end, because the 9th point is the one most seniors were never clearly told at the beginning. The first thing you need to know is that these 3 medications are not the same drug doing the same job. They all lower blood pressure, but they do it through different systems, and those different systems create different side effects, different warning signs, and different questions you need to ask. Amlodipine is a calcium channel blocker. Lisinopril is an ACE inhibitor. Losartan is an ARB, an angiotensin receptor blocker. That may sound technical, but here is why it matters. If you do not understand that they work differently, you can misread what your body is trying to tell you. Amlodipine works by relaxing and widening blood vessels. Think of your artery walls as muscular tubes that can tighten or relax. Amlodipine helps them stay more relaxed, which lowers pressure. Lisinopril works differently. It blocks part of a hormonal system that makes blood vessels tighten. Losartan works on that same blood pressure system too, but at a different point. It blocks the place where the tightening signal tries to act. 3 medications, 1 goal, 3 very different body responses. And that leads to the second thing every senior needs to know. If you are taking amlodipine, swelling in the ankles, feet, or lower legs is one of the most common things that can happen, and many people are never told clearly enough what it means. For some seniors, it starts subtly. Shoes feel tighter by evening. Socks leave deeper marks than they used to. Your legs look more normal in the morning and more swollen by dinner time. That pattern matters. Because when swelling changes over the course of the day like that, many people panic and assume their heart is failing. Sometimes they become embarrassed. Sometimes they stop going out. Sometimes they do what Margaret did and begin adjusting the medication without guidance. But the most dangerous part is often not the swelling itself. It is the silence around it. You do not get points for suffering quietly through a side effect that should have been discussed. And you should never feel that swollen ankles automatically mean the medication is harming you in some mysterious way. What matters is this: report it, do not hide it, and do not start skipping doses on your own. The third thing you need to know is about lisinopril, because if you are taking it, one symptom in particular can confuse seniors for weeks or even months. The dry cough, not chest congestion, not phlegm, not a cold you can shake off, a dry, nagging, persistent cough that seems to come from nowhere and refuses to fully leave. Here is what makes it so misleading. It does not always start right away. Sometimes a senior begins lisinopril, feels fine at first, and only later develops that constant throat tickle or late-night cough. By then, they no longer connect the symptom to the medication. They blame dust. They blame the weather. They blame reflux. They blame age. I once spoke to a man in his early 70s who had changed his pillow, bought a humidifier, and started avoiding certain foods before anyone finally asked the simplest question of all. When did the cough start compared with the medication? That question changed everything. A dry cough from lisinopril is not usually the same as an emergency, but it is absolutely something to report. Because sometimes the answer is not more suffering. Sometimes the answer is simply that another medication may suit your body better. But there is something else here that matters even more. And this is the fourth thing every senior needs to know. If you are taking lisinopril and you ever develop swelling of the lips, tongue, face, or throat, especially if breathing or swallowing feels difficult, that is not something to watch and wait on. That is urgent. Move quickly. Get help immediately. Most seniors will never experience that problem, but the ones who do cannot afford to be casual about it. A dry cough is something to discuss. Swelling that affects the mouth, tongue, or throat is something to act on. The fifth thing you need to know is that some of the biggest risks with lisinopril and losartan may not be sitting in your pill bottle at all. They may be sitting in your kitchen, because both lisinopril and losartan can raise potassium levels, and many seniors do not realize how easily extra potassium can sneak into the day. Salt substitutes, heart-healthy seasoning alternatives, certain electrolyte products, some supplements, meal products marketed as smarter choices. A senior can feel they are doing exactly the right thing for their heart, while accidentally pushing potassium in the wrong direction for the medication they are on. And the frightening part is that high potassium does not always announce itself loudly. Sometimes it is muscle weakness, sometimes cramping, sometimes an odd fluttering heartbeat. Sometimes it is very little at all until the lab work tells the story. That is why labels matter. That is why the words salt substitute do not always mean harmless. And that is why one of the best questions you can ask is this: given the blood pressure medication I take, is this product safe for me to use regularly? That one question can prevent a very quiet problem from building over time. The sixth thing every senior needs to know is that your bathroom cabinet may contain another risk nobody thought to mention: ibuprofen, naproxen, regular anti-inflammatory pain relievers that feel ordinary because they are common. If you are taking lisinopril or losartan, especially if you also take a water pill, regular use of these pain relievers can create extra stress on the kidneys and complicate how your blood pressure treatment behaves. This is one of those problems that slips through the cracks because over-the-counter medicine does not feel serious. People mention prescriptions. They forget to mention the bottle they bought from the pharmacy shelf. And yet the body does not care whether something required a prescription or not. It only responds to what is inside it. So if these pain relievers are part of your weekly routine, even for arthritis or back pain, bring them into the conversation. Not someday, soon, because one overlooked medicine can change the safety of another. The seventh thing every senior needs to know is what happens when illness enters the picture. If you are on Losartan or Lisinopril and you get sick with vomiting, diarrhea, heavy sweating, poor fluid intake, or anything that leaves you dehydrated, the medication that seemed completely fine on a normal day may behave differently in a depleted body. This is where many seniors get into trouble. They think, I always take my blood pressure pill. I should be disciplined. I should stay consistent. And consistency is good until the body you are putting that medication into is no longer working under normal conditions. If fluid levels drop, blood pressure can drop too far. You may feel lightheaded, weak, unsteady. You stand up and the room shifts. That does not always mean the medicine became bad. It may mean your body changed, and the plan needs temporary guidance. This is why seniors should never think of blood pressure medication as something that exists outside the rest of the body. If you are sick and cannot keep fluids down, that is not the moment to guess. That is the moment to call. The eighth thing every senior needs to know is that the most dangerous blood pressure reading is often not the highest one. It is the reading you misunderstood and reacted to without context. Blood pressure changes through the day. Stress changes it. Pain changes it. Poor sleep changes it. Caffeine changes it. Talking while checking it changes it. Checking it immediately after walking across the room changes it. Checking it while upset about checking it changes it. A single reading is not a verdict. It is a moment. And too many seniors let one scary number dictate the emotional tone of the entire day. They check again and again in panic. They measure with poor positioning. They take it after rushing, after worrying, after replaying the last number in their mind. Then they begin to believe the medication is failing, when in reality, the method was the problem. If you check at home, make the process boring. Same time, same general conditions. Sit quietly first. Use good positioning. Look for patterns over time, not isolated moments. One number can frighten you. A pattern can actually help you. And that brings me to the ninth and most important thing of all. These medications manage blood pressure. They do not erase the condition that produced it. That truth changes everything. Amlodipine may help relax blood vessels. Lisinopril may help block part of the tightening system. Losartan may block where that signal tries to act. But none of that means the underlying pressure-producing environment of the body has disappeared. Age-related vessel stiffness does not magically vanish because the pill is working. A high-sodium diet does not stop mattering because the reading improved. Poor sleep does not stop affecting your pressure because you filled the prescription. Inactivity, excess weight, chronic stress, dehydration, missed doses, over-the-counter medications, all of it still shapes the environment the drug must work inside. And this is the conversation most seniors were never given in full. A better number does not mean the story is over. It means the treatment is doing part of its job. The rest still depends on awareness, follow-up, and understanding. That is why the seniors who do best are not always the ones taking the most medication. They are often the ones who understand what their medication is doing, what it is not doing, and what signals from the body deserve attention before they become a crisis. So let me give you the practical framework clearly. If you take amlodipine, pay attention to ankle or leg swelling, especially if it builds through the day. Do not ignore it, and do not quietly cut back your dose on your own. If you take lisinopril, pay attention to a dry cough that does not go away, even if it began long after the medication was started. And if you ever have swelling of the lips, tongue, face, or throat, treat that as urgent. If you take losartan or lisinopril, be careful with potassium-containing salt substitutes, supplements, and products you assume are automatically heart-friendly. If you take losartan or lisinopril, do not treat regular ibuprofen or naproxen use as unimportant background detail. It matters. If you become dehydrated from illness, do not guess your way through it. Ask for guidance. If you monitor blood pressure at home, trust patterns more than panic. And for all three medications, never stop suddenly without speaking to the clinician managing your treatment. Let me tell you what happened to Margaret. Once the swelling was finally brought into the open, the fear began to loosen its grip, not because everything disappeared overnight, but because the problem finally had a name. It was discussed. It was reviewed. She stopped making silent decisions in the dark. And the moment seniors understand what they are dealing with, they often become calmer, smarter, and far safer in the way they manage their health. That is the real purpose of a conversation like this. Not to frighten you away from treatment, not to make you suspicious of every pill in your organizer, but to close the gap between taking medication and actually understanding it. Because information is not extra. For seniors managing blood pressure, information is part of the treatment. And now I want to ask you one final question. Which one are you taking right now? Amlodipine, Losartan, or Lisinopril? Type just the name, because the answer tells me exactly what seniors need to explain next. And before you take your next dose, carry this question with you. Do I truly understand what this medication is doing inside my body, what it can change, what it cannot change, and which warning signs I should never ignore? If the answer is not fully yes, that does not mean you failed. It means the conversation was incomplete. I am Dr. Clara Hoffman, and I will see you in the next one.